So we're very excited about this study, and we decided to explore the use of exercise as an adjunct to antidepressant treatment. And Mark talked a little bit about this as well, but we first started with a pilot study. And again, so this is getting to the point of remission, really wanting to make sure, because many, many times when individuals are first treated with an antidepressant, usually 2/3 of those patients will not remit, so they will not hit remission. They will have residual symptoms such as insomnia, fatigue, other issues such as cognitive dysfunction that still are creating problems for them and reducing their quality of life. So we targeted remission. As Chad mentioned, there are some neuroscientific data that suggests neuroscientific plausibility. Also, with respect to exercise augmentation, there can be synergistic effects of antidepressants and exercise, so this is one of the reasons we wanted to examine this. And then exercise, as I mentioned before, has a reduced likelihood of medication interactions and side effects, which is something certainly to consider in treating depression. So in that study, we had 17 participants. It was an open-label trial. They exercised with a 17.5 kKW dose, and we showed that there were reductions in Hamilton's depression scores. They were significant both for the total sample and as well as when we looked at the completers, and there were 8 completers. Remission rates for the intent to treat sample overall was 29%, and when we looked at completers, it was 63%. And we saw similar results with self-reported depressive symptoms. We looked at the inventory for depressive symptomatology and how that changed on a weekly basis. And again, we saw significant reductions both for the sample overall as well as completers. We also looked at quality of life. We used the QLESQ questionnaire that I'll talk a little bit more about later, but basically it evaluates general life satisfaction, and we did see a mean change from baseline. This assessment was only done with completers because it was done at pre and post treatment.